Hypothyroidism, also known as an underactive thyroid, is a common health problem that affects millions of people around the world. It affects the thyroid gland, a small, butterfly-shaped organ located in your neck, just below your Adam's apple. This gland plays a vital role in controlling your metabolism, which is how your body turns food into energy. When the thyroid gland doesn't make enough hormones, it can disrupt different bodily functions, leading to tiredness and weight gain. This causes a wide range of symptoms, often subtle and easily mistaken for other conditions like depression or getting older. The thyroid gland is like the body's tiny conductor, setting the pace of your metabolism and making sure everything runs smoothly. It decides how quickly your body uses energy and affects important functions like heart rate, body temperature, and digestion. Hypothyroidism is more common in women than men, and the risk goes up with age, especially after menopause. Certain things, like family history and autoimmune diseases, can make you more likely to get this condition. Recognizing the signs and symptoms of hypothyroidism is often the first step towards diagnosis and treatment, which can really improve quality of life. Early detection and treatment can help prevent problems and improve your overall well-being, allowing you to live a healthier, more active life. The thyroid gland makes two main hormones, thyroxine or T4 and triiodothyronine or T3. These hormones are essential for controlling metabolism, growth and development. T4 is the inactive form of thyroid hormone and is made in larger amounts than T3. However, T3 is the active form and is responsible for most of the thyroid hormone's effects on the body. Think of T4 as the raw material and T3 as the finished product. Changing T4 to T3 is a really important step in making sure your body has enough active thyroid hormone to work right. These hormones act like messengers traveling throughout your blood and interacting with different organs and tissues. They influence how quickly your cells use energy, affecting your basal metabolic rate, or BMR. Thyroid hormones also play a key role in controlling body temperature, heart rate, and digestion. Hypothyroidism happens when the thyroid gland doesn't make enough thyroid hormones to meet the body's needs. Several things can contribute to this condition, from autoimmune disorders to medical treatments. One of the most common causes is Hashimoto's thyroiditis, an autoimmune disorder where the body's immune system mistakenly attacks the thyroid gland. This attack causes inflammation and damage, making it harder for the gland to produce hormones. Another common cause is not getting enough iodine. Iodine is a very important mineral needed to make thyroid hormones. Medical treatments like thyroid surgery or radiation therapy for thyroid cancer can also harm the thyroid gland, affecting how it makes hormones. In the same way, certain medications like lithium can interfere with how the thyroid makes or uses hormones. Hypothyroidism often shows up in subtle ways, with symptoms appearing slowly over time. These symptoms can be easily missed or confused with other health problems. Recognizing these signs, especially the physical ones, is important for early diagnosis and treatment. Getting treatment early can really improve your quality of life. One of the most common physical symptoms of hypothyroidism is always feeling tired. This tiredness can be overwhelming and doesn't go away. This tiredness doesn't get better with rest and can make it hard to do everyday things. Gaining weight for no clear reason is another sign of hypothyroidism. This weight gain can be frustrating and hard to deal with. Even if you don't change what you eat or how much you exercise, you might notice you're gaining weight, which can be frustrating. Being more sensitive to cold is another clear sign. This can make it hard to be comfortable in places where other people feel fine. You might find yourself always grabbing a sweater, even when it's just a little cool, feeling colder than the people around you. Other physical symptoms include dry skin, losing or thinning hair, constipation, and a puffy face, especially around the eyes. These can be upsetting and affect how you feel about yourself. These symptoms are all connected to the slower metabolism caused by hypothyroidism. The body's processes slow down, causing these noticeable changes. If you have any of these symptoms, it's important to talk to a doctor or nurse for a proper checkup and diagnosis. Early treatment can make a big difference. Beyond the physical, emotional, cognitive, and reproductive effects, hypothyroidism affects more than just your physical health. It can also affect your emotions, how you think, and even your reproductive health. Emotionally, hypothyroidism can cause depression, a sad mood, and feeling irritable. You might feel sad, not interested in things, or like you don't have any energy. When it comes to thinking, hypothyroidism can cause brain fog, problems with memory, and trouble concentrating. You might find it hard to pay attention, remember things, or understand information. In women, hypothyroidism can mess up the menstrual cycle, causing irregular periods, heavier bleeding, or even missed periods. It can also make it hard to get pregnant because of hormone imbalances that affect ovulation. Noticing these emotional, cognitive, and reproductive symptoms is just as important as noticing the physical signs of hypothyroidism. Unraveling the mystery, diagnosing hypothyroidism. Figuring out if someone has hypothyroidism involves looking at their symptoms, doing a physical exam, and running some blood tests. The most common blood test used to diagnose hypothyroidism is the thyroid stimulating hormone, or TSH test. TSH is a hormone made by the pituitary gland in the brain, and it tells the thyroid gland to make T3 and T4 hormones. High TSH levels usually mean the thyroid gland isn't active enough. Another important blood test is the free T4 test. This test measures the level of free thyroxine, or T4, in your blood. Low levels of free T4 can be a sign of hypothyroidism. During a physical exam, your doctor will look for physical signs of hypothyroidism like dry skin, hair loss, swelling in the neck, called a goiter, and slow reflexes. The importance of early detection, preventing complications. Finding and treating hypothyroidism early is really important for preventing serious problems. If you don't treat hypothyroidism, it can have big consequences, affecting different organ systems in your body. One major worry is a higher risk of heart disease. Hypothyroidism can raise cholesterol levels, especially LDL cholesterol, the bad kind. This leads to plaque building up in your arteries, making you more likely to have a heart attack or stroke. If you don't treat hypothyroidism, it can also make fertility problems worse in women. The hormone imbalances caused by an underactive thyroid can disrupt ovulation and make it hard to get pregnant. Getting diagnosed and treated early for hypothyroidism can improve fertility and increase the chances of having a healthy pregnancy. Getting checked regularly, especially if you're at risk for hypothyroidism, is extremely important. Don't ignore the signs. Taking action and seeking help. If you notice the signs and symptoms of hypothyroidism in yourself or someone you know, it's important to do something and get medical advice. Finding and treating it early can make your quality of life much better and prevent problems. Ignoring these signs can cause bigger health problems later on, like heart problems, mental health problems, and even trouble getting pregnant. The first thing to do is make an appointment with your regular doctor or a hormone doctor, endocrinologist. Don't wait to call or send a message. Be ready to talk about your symptoms in detail, like when they started, how bad they are, and if you've noticed any patterns. Writing down your symptoms in a diary can be really helpful. At your appointment, your doctor will probably do a physical exam, look at your medical history, and order blood tests to check your thyroid hormone levels. These tests are really important for getting the right diagnosis. If you're diagnosed with hypothyroidism, your doctor will probably prescribe thyroid hormone replacement therapy, usually a pill called levothyroxine. This medicine is really important for managing your condition. This medicine helps get your thyroid hormone levels back to normal, making your symptoms better and preventing problems. It's important to see your doctor regularly to check how you're doing. Taking care of your health by being proactive and seeing a doctor when you need to can make a big difference in managing hypothyroidism and living a full and healthy life. Remember, your health is up to you.